So we did focus on one agency, Health and Social Services. Health and Social Services budget, as we learned, was $2.7 billion in total spending and $1.3 billion in state spending, which is about 25% of that $5.1 billion. About 70% of that budget is what we would call formula-driven. That is where the federal government or the state laws provide a certain level of service, such as in foster care, cash assistance to seniors, people with disabilities, and of course, $630 million in Medicaid, which we talked about last night. So we did spend quite a bit of time on Medicaid because it is such a big part of what the work ahead is. And we were reminded that there were 140,000 people today who are children, elderly, or disabled who are using that as their health insurance, which is leveraging about $1 billion. And I think many people were maybe surprised to learn that the government, both the commissioner and the governor, have already identified about $240 million in general fund savings for the program over the next 6 years. And that is really, when you add the federal match, $500 million. So that's a big amount of work that is already been committed to. If other pieces of legislation were to pass, such as the governor's reform plan, another $330 million in general fund savings could be accomplished. And then to remind, the Medicaid expansion saves the state in funds that they're already paying out in other areas, $108 million over that 6-year period. And net of that, a net of expenses, a $39 million savings. So we're talking big money in Medicaid, but we're also talking about big savings if enough capacity remains in the department and enough will occurs to continue to do these reforms. Our two groups had very little differences in the voting results, which was pretty surprising because the first group was very focused on people who worked in the business of healthcare, and the second was very responsible, good citizens. So most services were critical: abused children, behavioral health, healthcare, public health. But an interesting issue emerged in the area of senior services. There was quite a bit of voting to re-examine the state's programs that we offer to seniors, and particularly the Pioneer homes. You remember we have 6 Pioneer homes, and they cost about $61 million. And I would say both groups were pretty strong in saying that maybe that model needs to change. Maybe we need to look at privatization. If we can't afford everything, maybe this is an area. And in general, the whole senior services area, particularly the group 1 who had more time, said, we need to see all the senior program funding together. And that led us to the question of program budgeting, which many of you may remember used to be something we did as opposed to just by departments, so that you could see how much funding was going to certain program areas, and that was viewed as valuable. We also were reminded that we have the second fastest senior population, growing senior population in the country. So when you look at senior services, it will be a challenge to do reductions. The other question that really came up was the issue of the pace of change. So if we assume that things have to change because we can't afford them, how fast can we afford to do them? And this is really important when you talk about seniors, because seniors aren't people who can go out and get another job or change their retirement situation. So maybe your time horizon for planning is longer because you can't disrupt the situation of the existing person in the Pioneer home or the existing person in the assisted living, but maybe the future person. So, you know, when state government is sitting down and looking at their long-term planning for certain populations, they have to realize the challenges of the wheels on the bus are turning, and you have to change things as the bus is going, but how fast can you really do that? 2 other areas of focus. One was that the safety net programs have been proven over and over to grow in their need if you are in a recession. So if you are in a downturn and if you believe that the economy in Alaska will go into a downturn, I think we can expect some of these programs to have more need applied to them and more pressure. There was a lot of discussion in Group 1, because we had more time, about the issue of collaboration and innovation at the local level, and that perhaps with the state being siloed into the various budget categories, that we're not getting the efficiency that we could get if we did provide block grants or some kind of a heavy incentive for collaboration at the local level where they can even out some of the administrative costs and make things work a little bit more efficiently between all the different pieces. So that's our report. It was a joy to be involved with the group, and I thought we had an excellent dialogue. Thank you.